make the whole treatment as a consistency. So right now I have some video I would like to share to everyone about the acupuncture.
I think to say that there's medicine and then there's alternative medicine is to ignore one side or the other.
The first rule of any physician is do no harm. With medical acupuncture, I feel like I can give the patients a safer, more effective, more natural treatment.
We're a group of physicians first that incorporate acupuncture into our medical practice.
So regular doctors who want to learn acupuncture much as if they were going to learn any other specialty discipline in medicine.
My decision to study and practice medical acupuncture was not a decision against traditional drug-based therapy.
This would add a whole new way of looking at some of the chronic things that I was facing day in and day out.
The way to come out ahead is to blend and integrate and to capture the spirit of what's best in both worlds. So we want to have the best of both worlds.
Medical acupuncture is on the leading edge of the American healthcare revolution. Medical acupuncture is often associated with pain control, but it has much broader applications for preventing illness and promoting health and well-being. The World Health Organization acknowledges acupuncture as safe and effective treatment for a variety of medical conditions.
Medical acupuncture differs from just acupuncture in that it's a melding and combination of Eastern medical philosophy and Western modern technology. The technique I use is based on the human nervous system and its structure and function.
You don't have to believe in acupuncture to have it work. Just like you don't have to believe in penicillin to have it cure a pneumococcal pneumonia.
I think of it as an extension of my role as a physician trained in conventional Western medicine.
It's a paradigm or a system of medicine that enhances the ability of the body to heal itself.
When I integrate medicine with acupuncture, I have a better understanding of not just the symptoms, but also of the causes of illnesses.
The cause and effect relationships that we see in treating patients with acupuncture, to me, are very normal physiologic responses.
Those little needles sticking in there, I mean, they're not kind of magic bullets. They're just giving clues to your body about to pay attention to something and has not been doing a good job paying attention.
I think acupuncture is a physical modality that complements other treatments. What happens is as you become more in balance in the energetics of the body itself heals.
The needles are very important. They're sterile, they're disposable, and do they hurt? Most people say they, in most cases, don't even feel them entering.
Almost everyone that's been under acupuncture treatment will have a sensation of either euphoria or calmness or maybe both.
It's almost like putting in a computer software program in the body, using the needles as switches. Traditional drug-based therapy taught me to treat the problem that the patient had. Medical acupuncture has added to my life and to my treatment was it allowed me to treat the patient who had the problem.
To take the needles, place them intelligently, and begin a series of treatments and the patient that is either less in pain or no longer in pain it's a considerable privilege to have that tool.
I always feel so good and so excited when I can take a child off medication with acupuncture treatment. And the child feels good about himself because then he's not dependent on a pill to focus better in school, to breathe better. And parents also feel better that they're not popping pills into the child all the time.
Nothing in my medical training had prepared me for when I was in the HMO and patients were coming in. I need my codeine pills because otherwise my headaches will make me sick and I have to keep doing this. I say, why are have people taking narcotics all the time, and these weren't drug addict people, they were just normal people trying to make it through their life.
I want to treat these people that the interventional system doesn't want to treat or can't treat or is unwilling to treat because they don't see anything to treat.
When they come back the first or second week and it's help, many of them are surprised. They go, wow, I didn't expect it to help.
The patients are as excited as I am by the fact that their stories make sense all together, finally, to one doctor.
I spent over $10,000 of my own money. Lord knows how much of the insurance company's money to try to get rid of the pain.
I started last year. I was working in a restaurant and I slipped and fell in the kitchen and hurt my back. They sent me to a neurosurgeon to do some testing and they did some spinal blocks. By January, I was crawling across the floor. In February, I was locked into a 50-degree angle, and then they started talking surgery, and I panicked.
When I began acupuncture, to be quite honest, I was skeptical. So my first treatment, after about 20 minutes, and any of the pain I had in my neck was gone.
Well, I was bloated and had indigestion all the time, sick stomach, and I was so sick that I couldn't do anything. I was hard to get up even to go to the bathroom. My cardiologist wanted to go back in and open me back up. Well, the surgeon thought that was going to be a little too risky.
Luckily for me, the nurse case were good. I've heard some good things about a doctor who did acupuncture.
As each treatment progressed, I noticed more and more relief.
By the end of the 5 sections, I was able to walk a half a mile one way and turn around and come back.
I feel great. I really do. I feel really good.
I went from absolutely terrified and frustrated, thinking I might not even walk normally again, be able to get in and out of the car, ride horses, dance. Now, the future looks very bright for me.
Health is a process of living well. And part of the role of the physician is to help the patient live well.
It's really rewarding to help a patient take some responsibility for their own problem and to tap into helping the body towards wellness, which is really what it's trying to do anyway. It just needs a jump start sometimes.
I am seeing patients who really, the doctors have almost given up on. And it's really quite exciting when you find that they are better with just a few treatments.
I use medical acupuncture to treat a variety of childhood diseases, such as asthma, ear infection. Right now, the National Institute of Health is funding my research in using acupuncture for treatment of attention deficit disorder.
To see acupuncture help someone with the kind of chronic pain of their arm or their leg where they haven't moved it for years and they begin to have hope in their life, it's just incredibly powerful.
It's like treating the limb of the tree where the problem actually lies in the root. And when one starts to treat the limb, we find that the problem will reoccur. If one goes to the real cause and root cause of the problem, then things start to change.
It's kind of like one of these auto commercials, you know, if you don't go in and get the oil changed and a new filter, we'll see you later when we do a valve job, all right? Well, the acupuncture is like, let's do the oil change, let's do the tune-up, let's not wait till you need a valve job.
So, you saw the video. What is the acupuncture? How does that work? So that's why today we're going to talk about. Again, all of you are going to be a doctor. You're going to be start practice. Just remember, when you see the patient, treat the patient